Good evening. Thank you for coming. My name is Al Cruz. I've lived in Marshall since the fall of 1968 when I came to Southwest Minnesota State College, now SMSU. And I grew up on a farm, and farming has always been an interest to me. But I joined Land Stewardship Project several years ago, and Land Stewardship Project has been involved in healthcare. Why? Because healthcare is important to farmers, especially beginning farmers. When you're trying to start out and you got one person has to work off the farm so you can have health insurance. And even that isn't working anymore with the high deductibles and the high costs. So on behalf of the Minnesota Nurses Association, the Minnesota Nurses Association of Avera, Cure, with their Rural Democracy Project, and the Marshall Peace Seekers, I thank you for coming to our meeting tonight. And we also have another guest, HCAM, is in the back there, and they're a partner in this healthcare movement across the state of Minnesota and even nationally. And so if you have a chance, I invite you to stop at their table and pick up information. Ann is back there. We have tables for information from Land Stewardship Project and Cure's Rural Democracy Project. We have a lot going on in Southwest Minnesota. When people say there isn't anything going on out here, they aren't even trying to find out. I mean, that's the truth. So healthcare is important to all of us. It's a basic need. We talk about, is healthcare a right or a privilege? Doesn't matter. It's a human need. We will all need health care. We just don't know when. We usually use it most when we're very little and when we're very old. But the fact is that there is never a day when we aren't without potentially the need for health care. If we have an accident, we get sick, we break a bone or whatever. I mean, we are just a split second away from needing health care. So we want everybody to have access to affordable, quality health care. We believe that that's a human need. We can't do it alone. We can't leave people behind. Our communities suffer if we aren't in this together, if we aren't all working toward a goal of everybody doing better. And as Paul Wellstone said, we all do better when we all do better. Hubert Humphrey said something about, we're going to be judged by the way we treat the very old and the very young and the infirmed among us. So we're going to explore some ways to help solve our healthcare problem in Minnesota and in our nation. And at this time, I'm going to call up the president of the Minnesota Nurses Association, Mary Turner.
I'm Mary Turner, president of Minnesota Nurses Association. I'm into my second term. As far as Marshall, Minnesota, a portion of my relatives, does Garvin ring a bell?
Yeah.
All right, there you go. Frisbell's, okay. So I remember being young and being down here, so that makes me part rural. The other part is up in Thief River, and then that goes. Anyway, spent time on the farms, but I'm here to start this off because in this presentation I'm going to be the storyteller, okay? Because I'm an intensive care nurse at North Memorial in Robbinsdale. It's a level 1 trauma. We get folks from the 5-state area coming to our hospital. And I'm going to start off, I'm going to just cut to I'm a night shift nurse. When I'm not working as president, I'm putting in 40 hours of pay period on the night shift in the intensive care. And I'm going to start off, my first little story will start off tonight just to illustrate this healthcare crisis that we're in. And the 2 words I'm going to start with is Alex Smith. Now this was a news story not too long ago about a young man who, you know how now under the Affordable Care Act your kids can be covered till they're 26? Okay, any of you have kids or grandkids that are in their 20s, and you kind of have that dread as a parent nowadays as your children get to be that 26 and you kind of, you're thinking, are they gonna get a job that'll give them health insurance? Is their employer gonna be kind enough to give them enough hours so they can qualify? Does this sound like anything that, it certainly is me with my 4 children, okay? This was an anxiety. So anyway, Alex Smith became 26. Alex Smith had type 1 diabetes, so that means he was insulin dependent because his pancreas would not produce insulin, so he had to have insulin. Alex Smith, when he turned 26, was kicked off his parents' insurance. He no longer could afford the insulin that costs up to $800 a month for a bottle of insulin. Alex Smith died, was it 17 days after not having insurance? He lasted 17 days. This shouldn't happen in the richest country in the world. And the sad thing for me, when I was up at the Capitol, is I work in a level 1 trauma, and right next to me at that rally that we did were the doctors from Hennepin County Medical Center. And we both knew, HCMC, that that young man sat at home in his apartment and said, I feel awful, but I can't go in because I don't have insurance. But if he would have walked into the emergency room of either one of our hospitals, we would have saved him. We would have put him on an insulin drip. I'm sorry, folks, but this one really, because we get, every night we have people like this. We have diabetics coming in that we're putting on insulin drips. And we could have saved this young man, but he sat in his apartment and said, I know it. He said, I can't go in because I don't have insurance, so I can't go to the hospital. That should not be the fate of our young people. We should not have to worry about this. This is my first story to illustrate the healthcare crisis that we are in. And with that, I gotta dry my tears in. But all right, I do it right?
Just one story of many stories, and we all know stories. Now I want to call up another close personal friend of mine to offer us a prayer, Reverend Stephen Rasmussen.
Well, first of all, on behalf of St. Stephen's, I'm a member here. I would like to welcome you to this facility and also to tell you the important places to go should you need to. Down the hall, as you go directly west, you'll find the necessary rooms on your left side. And so feel free to make use of the facilities as you're set. We are honored to have you here. As you know, there is an entire gospel written by a physician. He also wrote the book of Acts, Luke. And in the book of Luke's gospel, Jesus is seen as the great healer. His first act of healing is among one of his disciples. He goes to Peter's house and he finds that Peter's mother is ill unto death. And our Lord's first work is to go up with his family, that woman's family, gather around and through the work of his hands to heal that woman so that she could then rise and take what she knew to be her rightful place in the community. And she served them dinner. The gift of health is something that is spiritual, it is physical, it is emotional, and it is essential. And so let us bow our heads as we gather this evening. Gracious God, we thank you that you have made us to be humans with that incredible gift of your presence within us. Use that presence among us this evening to guide us, to help us learn, and to help us grow into better servants of one another as we serve you in Christ's name. Amen.
Thank you. And now I would like to introduce another close personal friend of mine who also graduated from high school in 1968 and came to Marshall to the College on the Prairie. We went to school together for 4 years, and we politicked a little together, and he drugged me back into this Land Stewardship Project. And whenever he calls, there are a few of us in this room, you can raise your hand. When Paul calls, we say, how high do we need to jump and where do we need to go? And so I'm going to introduce to you Paul Sobocinski, an organizer with the Land Stewardship Project.
Well, thank you, Al. Appreciate that. First of all, my background, just for people to know, is I'm actually a livestock farmer from Olvasta, Minnesota, besides working for the Land Stewardship Project, and been involved working on policy issues for a number of years. And for the same reasons that Al described about how it affects farming and agriculture and our rural businesses, that's why I'm involved in this issue, and that's why Land Stewardship Project is hosting this meeting tonight along with Minnesota nurses and our co-sponsors. So thank you for participating tonight. What I'd like you to do is just open your packets if you haven't already and just pull out your agenda sheet. This is just going to be a quick review. You've heard part of it already, the opening, introduction, and prayer. But one of the next things on the agenda is we're going to introduce this video that we have up here of Hammy Kolsar from Wilmer. We want you to hear her story. You know, very often people hear the story of people who immigrated to this country and they have a perception about what that's like. And hear the story of the people that she works with. I also want to point out there's some handouts in your folder too, like we have a handout of Laura Ferricks, who did a presentation at a special program at a governor candidate forum, and that's what Andy here was also did a presentation at a governor's candidate forum in Wilmer back in late April. Then we're going to move on and talk about Vision for Rural Minnesota. That's this sheet here that's in your packet. We'll be visiting a little bit about that in the program, and talk about how we came, to formulate that, how people came together. From there, we're going to move into small group discussions. And we want to hear more healthcare stories. We've heard a couple here now. We're going to hear one here too. And have discussions. We want to have your input. The idea of having discussions in the round tables is to gather your input and to start to think about what values do we have in common together. And looking at that, looking at how we get to a solution. And trying not to think at this part of the section of the meeting, not on all the policy solutions, but rather how we come together so that we drive this issue hard enough to force elected officials, whoever they are, to start to really do something about health care. And then finally, we're going to have a presentation from the Minnesota nurses, their executive director, Rose Roach, who's going to talk about a policy option, a Minnesota plan for people to look at. You don't have to agree with it. We want people to hear it. Because I think in the end, we're all going to have to hear different ideas out there and test those ideas against our values. So that's an introduction of the agenda. With that, we'll start here with this video. I'm going to ask my good friend technician who I just met tonight to make sure I don't goof it up, because that's not my talent.
So if the sound's not working, it could be Discord.
While they're doing that, I'm just gonna step up here and say a few things to get it started. Take a minute and pull out the bold solutions we need for healthcare, a piece that was done by a member of ours, a beginning farmer. Take a look at that, Laura Ferricks. And part of that whole piece and coming up was telling stories to people who were running. We had this forum in Wilmer, Minnesota, in which all the candidates for government, the governor, from both sides of the political aisle were invited, and people presented in front of these candidates. And the idea was to start looking at having solutions coming from the people, and those candidates hearing that about the need for real change. And part of Laura's story that's in here, if you take a look at it, was to share a story and say about the need for something really to get done on healthcare to be strengthened.
How about Jim and I do
We'll come back to this. So, we're going to jump ahead, and I'm going to bring James Connie up, and on your agenda it says Lori Dreesen. She got sick tonight and wasn't able to come, so another person who has been part of this effort in terms of leadership development of Land Stewardship Project and part of LSP's vision statement is James Connie. I'd like to welcome him up, and he will start this part off.
Good evening. It's really nice to be here this evening with you all. I'm here along with Darwin Dice. We'll be talking about the vision for rural Minnesota. If you would take that out of your packets now, please, I'd appreciate it. Because we'll be referring to some bullet points in there as we go through this. Now, both Darwin and I, along with many other people, took part in developing this vision statement. It was done at meetings such as this throughout southern Minnesota. And we got together and talked about what we had in mind for a healthcare system going forward. And a vision, not just in healthcare, but a vision for rural Minnesota in all the areas. And healthcare was part of it. And we talked and put our ideas down on cards similar to what you see on the table here tonight. And we put those cards together. There were like 700 of them or something like that. Different points that all came together into this little piece that you got here. In other words, not everything was included verbatim, but we tried to bring everything together in spirit, if nothing else. Now, there are some things in there that we brought together. One of them was the values. And the values you see on the front page here, you can kind of read them down with me. Every person has value that can't be earned or taken away. Similarly, there is inherent value in the land, water, and natural world that gives us life. Now, each one of these value statements are things that I think everybody can agree with. Being part of a community brings meaning and richness to our lives. We depend on each other and on the world around us to survive and thrive. I think that's particularly important tonight when we're thinking about healthcare. We are stronger when no one is left behind and everyone has opportunity to contribute fully. We all have something to offer. Think how that reflects on healthcare. We care for each other and we prioritize protecting and improving our surroundings to leave things better for our children and our grandchildren. What will our legacy be? Now, turning inside, we're not going to go through all the challenges. We're just going to look down here at one on healthcare tonight, and that is health insurance premiums, deductibles are unaffordable. while hospitals are closed and services cut in our communities. This is a particular problem in rural Minnesota. Now, we found that this vision statement here is a good tool for facilitating conversations and bringing people who aren't necessarily, what do you say, in the in-group together and get talking about what's going on and going forward from there. We often have things that we want to talk about that are maybe a little too political, but if we can talk about things out of this, it's not necessarily political. These are real values and things that we all have in common. Now, Darwin's going to talk about now the vision that we have for rural Minnesota. Thank you.
All right, well, I'm excited to talk about all this stuff, but I'm also really excited to get you folks' input on things. Do make sure you have time to read through some of these things here. When we talk about the vision and that whole process that people got together from all over the state to help come up with this language, kind of a new narrative that's from the ground up. And it doesn't view that kind of like all the corporations, they know what's best for us. And they'll take care of us, and we'll continue to give them huge tax breaks and things like that. But there's really a lot of potential in here. Take a look at that 3rd and 4th page, and I'm not going to go over all of it, but I just think it's almost like a beautiful language here. Vibrant communities are a place of belonging and opportunity for everyone. Same thing with health care. Everybody in, nobody out kind of thing. Looking at the countryside where the soil, water, air, and natural world are healthy. We owe our very existence to a 6-inch layer of topsoil. And once that's gone, we're going to be struggling. But we're going to change that so that we protect that. Strong local economies. Rural Minnesota, we're committed to building a farming system that cares for farmers and the land and makes healthy food available to everyone. No arguments there. But about healthcare, high quality healthcare system that takes care of everyone and frees us to pursue meaningful lives. So there's security in all of that, knowing that we can easily receive medical care, that we can afford it financially. Those last 4 lines under that part, removing worries about healthcare allows people to start new businesses, engage more deeply in our communities, and pursue happiness. When your healthcare is not tied to your work, tremendous opportunities can happen as a result of that. Anyway, and then coverage that's available at a cost that each family can truly afford. We need quality medical care to be available and close to home when we need it. We're not going to be able to make it having Burger King fundraisers for everybody each time there's a healthcare crisis. It just doesn't cut it. And it's a great way, I must say, for people to feel community support, but we need something much better. Communities grow our future by valuing families and children, and where people have a say and we can shape our own future. So anyway, let's have some time for us to share a little bit and get on with this program here. But thank you.
Are we going to try the video one more time? Or?
Is it going to work?
Let's just go ahead and do
Let's
it.
just-
Okay, so it seems like unfortunately the video is not going to work, so we're just going to go ahead to our small group discussion time. My name is Johanna Ruprecht. I am an organizer on staff with Land Stewardship Project with Paul. I also work on our organizing for a better healthcare system, along with some other work as well. I work in the Southeast Minnesota office over in Lewiston. So I just want to introduce a little bit of why this discussion piece is important here tonight and what we want to ask you to talk about. And then in just a little while, we're going to take 20 minutes to do that, to talk at your tables. So we wanted to make sure a piece of the meeting tonight was a chance for all of you to talk with each other in your small groups about your own healthcare stories. What are some of the challenges you're facing, whether it's accessing affordable care in your own community where you live, whether it's with insurance, being unaffordable or inaccessible. We often, I think, are told a story that tells us, healthcare is something everybody has to deal with on your own, and it's your own responsibility to figure it out or not, and if it isn't working for you, that's just your own problem. But we don't believe that way at the Land Stewardship Project. I think our other partner organizations that are involved with this too, we feel like it really is something that we have to deal with together. It's a community level issue and a problem, and so we need to come together and share our stories with each other and connect around the challenges that we're facing. So that's an important part of this small group discussion time tonight. And we also want to have, like Darwin was saying, some conversation around the level of our values about healthcare. We feel like we haven't really gotten anywhere solving the healthcare crisis if all we're doing is talking about, this is the best policy solution, we need that. We want to take a step back to the level of also talking about what are our values that say why we need a certain solution or not. What are principles or beliefs that we hold that we think a lot of other people would also hold that we can use to connect and to bring more people in around this issue and kind of try to build some power to break through some of the deadlock that it seems like we have on this. If we can identify, this is a really widely shared value that a lot of people agree with, we can say to our elected officials, this is what people believe about our healthcare system, and we need to see a solution that makes this be real. So you can use this vision for rural Minnesota as kind of a guide to start. There's values identified here. There's a LSP's vision that we've identified so far for a healthcare system, but we definitely want to hear your other ideas as well that aren't necessarily expressed in here. But we want to kind of have that conversation, not just what is the solution that we need or solutions that we need our elected officials to enact to fix the healthcare crisis, but why is that needed? What are our shared values or principles that we can point to say we need solutions that are based on this or that fulfill this idea. So in your small groups in just a minute, we want to share with each other what is your healthcare story, and then what do you think are shared values or principles related to healthcare that we can demand our elected officials fulfill with real healthcare solutions. And so I want to ask everybody, if this works, it looks like we had a few more people than we were expecting even, which is great, but I have 9 people. Can my 9 table facilitators raise your hands? Okay, so at those tables, we have somebody who has a sheet of paper to take notes and is prepared to just help keep your conversation going. So I want to ask everybody, if at all possible, to move to a table that has a facilitator at it. And if facilitators need to move around to make that a little easier, I would say just do that for a couple minutes. Try to get to one of those tables and then get started. All right, thanks.
So with that, we're not doing too bad in the program. We're at 8:03, and we have Rose Roach from the Minnesota Nurses that I want to welcome up. Our organization, Land Stewardship Project, has worked hand in hand with the Minnesota Nurses and other organizations down at the Capitol because it's not just one sector or one group that's going to get this problem solved. We all have to come together. We all have to work together. And I just want to say that Rose is going to offer one policy option for people to look at, to think about, talk about. We will need to do this a lot more, how to have a civil conversation, do this, to hear options, and to look at how we can move forward. So with that, Rose, welcome.
You're going to introduce the questions.
Technology.
Well, you got to make sure these voters.
Oh, that's right. You're going to pass up.
They're here, we just got to point out the fact.
We just want to point out, as Rose is presenting, we do have question cards. If someone has a question, jot it down. We want Rose to get through her presentation, and after that, we'll collect those questions and bring them forward. Okay. Security.
Well, good evening, everyone. As Paul said, I am Rose Roach, the Executive Director of the Minnesota Nurses Association. My first disclaimer, I am not a nurse. So if you go into cardiac arrest or anything, I'm looking at my boss and another boss over there that I know can come help out. I'm a trade unionist. I've been 30 years in the labor movement. across both Minnesota and California. And so I'm back here working for these amazing nurses whose number one long-term goal, as far as a legislative priority, is to make sure that somehow, some way, we get a humane, patient-centered healthcare system in this state, in this country, one way or another. So they are out there fighting this good fight for y'all every single day. So I like to start these on a lighter note. So here we are in Minnesota, right? So I'm going to use my Minnesota voice and tell you a quick little joke. So Ole worked in the fish factory up in Duluth, Minnesota. And one day he had an accident. And he lost all 10 of his fingers in the accident. And they rushed him into the hospital, the emergency room. And the doctor looked at him and he said, "Oh my goodness, Ole, where are the fingers?" And Ole said, "Well, what do you mean where are the fingers?" And he said, "Well, nowadays we can take the fingers and we can reattach them and you could be good as new." And Ole looked at the doctor and said, "Well, how the heck was I supposed to pick them up?" So this is, the reason I use this is because that's how it feels sometimes about this healthcare system, right? How are we supposed to pick up the fingers when we have no fingers to pick them up with? So with that, I'm going to start this presentation by just setting sort of a little bit of the table of what we're currently dealing with some, little statistics, little background, and then move into what the nurses think is the way we should be moving forward. So, I need to turn it on. That's a good idea, Rose. Always takes a second. Oh, darn it. Okay. Let me do this, at least to get it going. It's not even moving.
Technology.
I'm not sure why boy, we're having technology problems tonight, aren't we?
We're going to the hospital.
Yeah, I don't know what there we go. All right, let's see if we can make this happen. So I don't know if anyone's read this book called An American Sickness. Elizabeth Rosenthal is a physician. I highly recommend it. It'll make your head explode, and you'll need healthcare. But it's really, really an amazing book to read. And a couple of quotes from there that I think are really kind of set the stage, right? Transformation of American medicine in a little over a quarter century from a caring endeavor to the most profitable industry in the United States. The medical industrial complex has made money the metric of good medicine. And the medical industrial complex is a real thing. It spends more money on Capitol Hill than the oil industries, than the defense industries. So we wonder why the system is the way it is, right? Hugely expensive medical care that does not reliably deliver quality results. And there are certainly facts to prove that. Little bit of history. We've been trying to reform the healthcare system for a lot of years in this country. This is not new. We're not in a, sort of a new fight here, right? Way back in 1915, the American Association for Labor legislation was offered. It had a national healthcare program. It was defeated. Within the Social Security Act, when it was first proposed, it included basically Medicare for all. And it turned out that they couldn't move Social Security as a pension system, right, with that piece in it, so they decided to fight that fight separately. And thank God we have Social Security, another one of those things we've got to continue to strive to fight for. The Murray-Wagner-Dingle bill in the 1943-48 ended up being defeated. Truman was a big supporter of moving towards some sort of a national health program. Then in the 1950s, you have the unions beginning to get involved and employers saying, gee, maybe this is a benefit we should offer as part of an employment contract with our employees. Right? Now it gets hooked to actual employment. Healthcare gets hooked to employment. We become the only nation in the world that connects healthcare to employment. In 1965, of course, again, thank God, the Medicare Act passes, right? Medicare and Medicaid become a reality for us. And you know what's interesting in this day and age is we computers and blah, 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 a lot of times what we'll hear about, we can never move to a system that would like just cover us all, at one time. How would we do that? Oh my goodness, oh my gosh. In 1965, none of these things existed. None of them phones existed. And within 11 months of the passage of that bill, They had every senior citizen 65 and over ready to go and had cards, and they could go to the doctor. Right? With paper, they did that. I'm pretty sure we can figure this out. In 1973 is where you now begin, for the first time, healthcare can make a profit in this country. Prior to 1973, healthcare was actually a not-for-profit. You were not to make a profit on healthcare. Now we've got, and if anybody wants to ever Google something, a conversation, it's an audio conversation, I think it was between Haldeman and Nixon, where they're talking about Kaiser, and anybody who knows California and out on the West Coast, Kaiser Permanente, right? About how this guy Kaiser has figured out how to do these HMOs, these health maintenance organizations, and make money off it. And you can hear Nixon say, "What do you mean, make like a profit? I think that's great. Good, good, good. Let's go for that." So that's where you start to see HMOs come into being. Then in the 80s, the problems really start to escalate, right? Now we've got deregulation of the industry under President Reagan. You're seeing co-pays, deductibles, all that good kind of stuff come into play. The share of the premium cost by an employee is getting higher and higher, right? Because it's getting shifted onto the employees. So you're losing pay because you're putting the money onto the benefit instead, right? Less and less dependent coverage becomes available. We're getting more and more people either underinsured or completely uninsured. And the profit-driven system really begins to explode, particularly with pharmaceuticals. Right? That's a fun group. So 93, 94, we see Hillary Care, right? And if you look at, it's a really interesting graph. It shows insurance premiums doing this, and then all of a sudden in 1992, 93, it goes like this. And you know why? It's because they started talking about this, right? They started talking about we should do something. The minute we start talking about actually doing something, they start dropping the prices a little bit, right? And then when it doesn't happen, you see the spike go up once again. And then in 09-10, we've got Obamacare, or the Affordable Care Act as it's known. And then in 1670, we had the proposal for the repeal and replace of Obamacare without really a good understanding of what the replacement was going to be. But that was the kind of catchphrase. So, Senator John Marty, who's a hero certainly for the nurses, and is supporting, the bill in the Senate that would create a good health care plan here in Minnesota. He's right when he says the ACA is the first time that we as a nation have made the commitment that everyone should have health care. I think that debate to some degree, it has actually happened through the debate about the Affordable Care Act. But of course, the Affordable Care Act had a major flaw to it. And that major flaw is the fact that it preserves the insurance industry, right? So when we look at why is that a flaw? Why is that a bad thing? Well, I mean, some of the things that it's connected to is that it leaves the employment-based insurance unchanged, right? So if you had an employer that provided this, that stayed unchanged. This idea of market competition kind of cracks me up. I don't know what that means in healthcare. They seem to mean, it's about cost. It should be competing about quality. Wouldn't that be nice if we were competing on quality versus cost, right? Because the reality is we aren't bringing all those characters on the first slide there, Humana and Cigna and Aetna and Blue Cross Blue Shield into a room and having them bid on the brain tumor, right? Or the lung transplant. What in the world does it mean to compete on healthcare? It's health. It's not a consumable good. We don't buy it like we buy other things and walk into a store and just buy a little health one day. That's not how it works, right? I mean, seriously, people, when they do, I think to myself, are you kidding me? This is just insanity. We don't buy health like we buy other things. It doesn't fit in that marketplace for that reason. Nothing but experimental pilot programs to try to contain costs, no proven cost containment provisions whatsoever in the Affordable Care Act. There was no negotiation of bulk purchasing of pharmaceuticals. This is one of the most criminal things about, also Medicare Part D. Y'all remember 2003 when they implemented Medicare Part D in the middle of the night, literally? And the guy who was in the House of Representatives at the time, I think it was, his name was Billy Towson, And he said, we can't have any negotiation of purchasing of drugs. We just can't do that. We're capitalists and this would be bad for the market and et cetera, et cetera. So they made it illegal for our country to negotiate with our pharmaceutical companies over the purchase of pharmaceuticals for our government health programs. Now every other country negotiates with our companies, but not us. And within months of that passage, Billy Townsend went to work for guess who? Big Pharma. Yeah, made tons, millions of dollars, okay? Limited lists of doctors and hospitals, so we keep doing this, well, we'll just narrow a network. That'll cut costs. What? I want to go to the doctor I want to go to, right? That's how we all feel about that. It adds needless complexity. We keep adding more and more and more layers of complexity. That adds cost, folks. That's all there is to it. It adds cost. There's millions that still remain uninsured, and there's no change in the way we pay for health care in the bill. That's why it didn't really get to an ultimate fix. Some good stuff, right? The pre-existing condition thing, incredibly important. That's insurance abuse, and that started to get dealt with in the law. That is important, but it didn't get us to where we needed to be, which was right, everybody can access affordable health care. Important to just take a moment to note what people are going through. We heard some of it in here, so I won't dwell on it a lot. But you know, many people, 63% report using up most or all of their savings to deal with medical costs. 42% took an extra job, right, just for medical bills. You've got people making choices like food or healthcare costs, using up credit cards, savings, retirement accounts, things of that nature. Among the insured with problems with medical bill, a quarter of them say that they received claim denials. That's another big, huge problem, right? And almost 6 in 10 of those with problems paying the bills say that they've been contacted by a collection agency. And I'm very proud to tell you that a year ago, just last month, the Minnesota Nurses Association put our money where our mouth is, and we purchased $2.5 million of debt for 1,800 families in the state of Minnesota, and we relieved that debt for them. We tore it up, right? And that's the right thing to do, and we're going to do that again this year. We're not sure if we're doing it here, or maybe Wisconsin or Iowa, and help some of our brothers and sisters out around the 5-state area. So workers, right? We're a union. We represent workers. And this is what's happening across the country when this impact of this particular quote-unquote benefit for workers. That sort of, I don't know, alligator mouth is unsustainable. Because what you've got there at the lowest level is the overall inflation, then you have workers' earnings, and then you have the workers' contributions to premium, which is the highest one there at the end at a 221% increase over about a 15-year period, and then health insurance premium costs just below it. How do we sustain this? From either an employer or an employee perspective, quite frankly. We have something in common with our employers on this one, without a doubt. We can't bargain this beast anymore at the negotiations table for the unions. Because all we're doing is screaming at each other about who's going to pick up the cost. We never deal with why does it cost that in the first place, right? So interesting to know that the Department of Labor has estimated that about 1 claim in 7 made under employer health plans are being denied. That's about 200 million claims a year. So just because you have employer-provided, health care doesn't automatically mean it's just the best of the best and that you're not also struggling. So when you sit in a room, and I have many times with the industry, they generally will say to you, well, the reason that there's a 35% increase in your premium is because of you. It's your fault, right? A, you use the product, how dare you? So that's what we bought it for, right? That's kind of the purpose of it, right? And second of all, if you just take better care of yourself, if you just eat more fruits and vegetables, and if you just exercise more, that you'd be healthier and everything, the cost of healthcare would come down. Well, I think we could probably eat a little better, and I think we could probably exercise a little more. I'm not saying that we couldn't. Is that the major cost drivers in healthcare? Not by a chance. So we're old, we're fat, we're expensive, according to them, right? We use healthcare all the time. we're just running to the doctor. I always say, yeah, gee, I have Friday off. I think I'll pop in for a colonoscopy. I mean, what? Again, healthcare doesn't work that way, It's because we're irresponsible, not taking good care of ourselves, and of course, all the fabulous new technology that's coming about, right? So I'm going to become the ugly chart lady for a minute, and I'm going to run through these pretty quick because they're just meant to make an impact, right? When we compare ourselves to the rest of the industrialized nations of the world that at least provide health care to their citizens on some level. It isn't necessarily single payer, it isn't necessarily socialized medicine, it's all kinds of mixtures, right? But they at least have people can go to the doctor when they're sick, right? That's the bottom line. And they don't have to worry about going bankrupt for doing that. So do we smoke more than them? Because we're told it's lifestyle, that's what's driving our healthcare costs. No, we don't. So are we older as a percent of our population than the rest of those industrialized nations? Not so much. No. Yes, right. Do we run to the doctor more often? No, we don't. How about the time that physicians spend these days, right, in dealing with this, electronic health records? That's what an EHR is. It's sometimes EMR, medical records. This is burning out physicians and nurses, big time. This is a major problem in healthcare in this country because nurses always are saying to us, chart. I spend more time at the computer than I do at the bedside of my patient. And the stuff that they're putting in, yeah, some of it has some relevance and, it's your stats, right? Some of it, most of it, is about coding to make sure they get paid, right? It's nuts. And social determinants of health are a really big factor in this country. In many other countries, industrialized nations, they do things like, provide you automatically paid time off when you have a baby, right? They might make sure that you have access to food, to healthy food, through some means. They, in some cases, housing. They make sure that everybody has some level of housing available to them. Those things contribute to our health. The nurses of the Minnesota Nurses Association, and I don't know if this will be a popular thing to say or not, but I'll just say it. We support the 15 Now movement. And people will say, why? Nurses make more than $15 an hour. Because poverty drives health outcomes. That's why. Poverty drives health outcomes. And if we can get to some of the root of what's causing people to be sick in the first place, then we can begin to bring our healthcare costs down. You all probably, from this farm community in particular, people will say, well, why is, those children are so obese in that poor neighborhood in, northeast Minneapolis or whatever. Well, try to go find a farmer's market there. Try to go find a grocery store that sells really good, high quality, fresh fruits and vegetables. Lots of Taco Bells, lots of McDonald's. For 99 cents, you can feed the kid, right? A burger and fries, but you gotta pay $6.99 for a salad. It's upside down. We really have to think about the things that are affecting healthcare beyond just what transpires in the physician's office. So our poverty rate, look at that. I mean, the OECD poverty rate average, we're way above it. That's pretty crazy in the richest country in the world. Income inequality gets worse. All these things are factors in our health. It may not seem like it, but they are. Look at that. What does that make you think? Maternal mortality. So this is moms having babies. Been doing that for a lot of years. And in this country, it's the risk of a woman dying in childbirth. Right? That's a problem. Life expectancy in this country is not as good. We pay way more for health care here, and we do not live as long or get as good of health outcomes. And then there's this thing. Somebody said something about it, I think, earlier, administrative waste. Can't say enough about this. They anticipate, or they project about 33 cents on every dollar doesn't go to health care. It goes to some sort of administrative function. Now, that's not just the insurance companies. That's also, anybody go into a hospital lately and see what their billing department looks like? Right? They gotta have a lot of people figuring out all the different plans and trying to fight with them to get reimbursed and, you know, what claim to file here and there. Doctors' offices, I served with a physician on the governor's, Governor Dayton appointed me to his healthcare financing task force a couple of years ago, and a physician from Bluestone County, that's a county, right? Bluestone County?
Big Stone?
Maybe, okay, maybe, and he calls it a Bluestone or something. Oh, I'm sorry, isn't it bad? I was out of Minnesota for a few years, and here you go. Well, I thought the name of his clinic at least was like Bluestone Clinic or something, so maybe I made an assumption about where exactly it was located. But he said he had just hired 2 registered nurses, and neither one of them were gonna touch a patient. Because they just needed to sit at a computer and input data. Right? That's nuts. That's upside down. And that's what's happening with this administrative waste that goes into it. I mean, you know, all that lobbying money I told you they spend, that's your premium, folks. That's a part of your premium. That's where it's going. This is probably one of the most stunning graphs that I ever show. What you see there on the bottom from 1970 to 2017, the sort of yellowish little line there, shows about 100% increase of physicians coming into the healthcare system. That great big, I don't know, aqua colored thing, that's administrators coming into the system. Doesn't that seem upside down? 3,000% increase in the people who are just pushing paper and never healing anybody, right? And then we got this. So these are CEOs of health insurance companies. And you can see what their salaries are. Those are annual salaries. And I was saying this at my table earlier. When I say that no one should profit from another human being suffering, I'm certainly not talking about doctors and nurses and LPNs and you know, technicians, you know, folks who are actually providing care. I'm talking about people who didn't heal anybody and made $66 million a couple years ago. I think this is 2 years old. What's that about? They make that money because they deny care. Because you can't make money in health insurance unless you take it in and don't pay it out. That, for nurses, is inhumane and unacceptable when it comes to a healthcare system. So drug company profits, another one of our fun groups, right? The yellow is the Fortune 500 median, and the red is where the drug companies are coming in on their profit margins. Right, so they're not doing so bad. And then you have hospital administration costs. I talked a little bit about that. All right, that continues to rise more and more all the time. I'm going to ask my president, Mary, to come up for 1 minute, or a couple minutes, whatever, to just tell a couple of more stories that she's experienced at her hospital. Because really, when it comes down to it, when we have this conversation about all this craziness, it really is about people's lives, right? When we're all said and done.
And I promise I won't cry about this one, because I was too pissed when I was saying this story to the Senate committee that I said a couple of years ago. So at one point, I work in the medical ICU, but at one point I worked on the trauma ICU. And one night, I had 2 trauma victims that had fallen. And they were on a respirator, they had a breathing tube, okay? And they had fallen because they had a diabetic crisis. They had the diabetic crisis and they fell. So during the middle of the night, one of my patients, Harold, had got his breathing tube out. And I says to him, I go, so it's 3 in the morning, I said, Harold, how did this happen that you weren't taking your insulin? You know, what happened? And he said in a very quiet, very sheepish way, he goes, well, Mary, I ran out of money. You know, as nurses, we used to think that people didn't take their meds because they're non-compliant. Well, that ain't the case anymore. It's they can't afford it, okay? I got a report on the other guy. He's still intubated. The story with him is he had insurance. He was diabetic, but he had insurance. He was buying his insulin. However, his son was also diabetic and didn't have insurance, so that father was sharing his insulin with his son so that his son could live. So that meant he wasn't taking the right amount of insulin. I said to the Senate committee, I said, at that time, it was at North Memorial, it was $12,000 a day in our ICU. And at that time, it was $500 a month for insulin. $500 a month to cover a diabetic's insulin and all the supplies versus $12,000 a day in the ICU. I said, you all do the math and figure out what makes sense. Not too long ago, a few years later, wrote my first opinion you ever done that in a newspaper? So anyway, it had come out, actually got published that Sunday. But it was doctors like, crisis is looming, and they were talking about this fact that diabetics can't afford their insulin. And so this was a looming. And I basically said, looming? I said, we had one night, we have 13 beds. In one night, in 5 hours, we had 5 diabetics come onto our floor and get on insulin drips. 5 diabetics in 5 hours. Every night, at least a third of our patients are diabetics, the other third are overdoses of some sort, and then the other third is just the rest of you all, with breathing and all that kind of stuff. I said, crisis loom, and I said, and every single one of those people was brought in by an ambulance, where they had been found down and were brought in. I said, crisis looming, crisis is here.
We are penny wise and pound foolish in this country when it comes to healthcare. So this is a lot of what we've been doing with this system, right? Tinkering with it. I will tell you that if we are going to continue to go down this path of incremental change, we are literally making the decision that you get to live and you don't. And that is literally what we're doing. And that's unacceptable. We can't do that anymore. I don't want to make that decision. I don't know about any of you. You probably don't either. But that's what tinkering around the system actually does. So just so you know, we're basically paying for a public healthcare system now. We're just not getting it. I sat next to the guy who works for the Minnesota Health Plans on that governor's task force, and he basically admitted that the health plans are now, more of their revenue is coming from taxpayer dollars than it is from the commercial market. So we don't know how they're spending it when they're getting it out of our government programs. We have no idea because there are not good audits to find out, are they actually paying that provider fully, or what's going into their pocket. The nonprofit health insurance companies in the state of Minnesota are sitting on $2 billion in reserves. So you can see how taxes are funding 2/3 already of our health spending through whether it's subsidies on the exchanges, whether it is government workers, because if you work for a school district, a county, a state worker, a federal worker, it's tax dollars that pay you. So obviously if you get health benefits through that employer, it's tax dollars that pays for that as well. The VA, you've got Medicaid, Medicare, right? That's where we're funding healthcare as it is now. So some folks will say, well, what about a public option? Because you hear a lot about a public option. A public option is not going to work inside of this insurance marketplace because they know how to game the system. Y'all heard of Medicare Advantage within the Medicare system, right? Traditional Medicare and Medicare Advantage. Medicare Advantage is a privatized portion of Medicare. They know how to cherry pick. I'm 60 years old, so I'm only 5 years from Medicare. So they know how to cherry pick to make sure that they get the healthier patients. They upcode when you do get sick so that they get reimbursed at a higher rate than they're supposed to. United Health just got fined literally billions of dollars for ripping off the government in doing that, right? They know how to game the system. You can't win within that system with them. It's not gonna work. So, some positive things that we could literally look at doing right now would be, in Montana. Montana, not like a big, blue liberal, state, right? They literally offer free primary care for their 11,000 state employees. We have a sick care system, not a health care system. We don't prioritize enough on the front end of preventive care. They're starting to deal with that. Oklahoma and Connecticut. Connecticut is like, isn't that the place where like lots of insurance companies are in Connecticut? Okay. Well, they kicked all the insurance companies out of their government health care programs. Just kicked them out. Focusing again on primary care, Senator Marty also has a bill that would move us in that direction. And Minnesota Care. This is where we could open it up, not with a silver or gold plan. I'm talking about the one that you all know about. Minnesota Care is a trusted program. It's a good program. Open it up and let everybody access the program as it is today. And I don't want to get too technical because I know we're getting short on time, but if in the exchanges they have, first of all, those plans that are based on metals, precious metals, right, which makes me nuts. But so if it's a gold plan, it means the insurance company is paying 80%, you're paying 20%. Okay, it's an 80-20 plan, right? Well, Minnesota Care is therefore a platinum plan because it pays 96% and you pay 4%. And then the premium you pay is based on income, right? Well, that's the plan. That should be opened up for everybody. And the other thing we have to do, though, is we got to kick the money changers out of the temple. Get rid of the insurance companies and the HMOs that are involved in our government programs, do direct contracting between the state and the providers. We can get control of this thing, and it would make a huge difference, particularly for greater Minnesota. There's no question about that. So, the problem we often hear, right, healthcare is too expensive, so the solution we've been given lately is, well, let's make it more difficult to get. That's how we'll get it cheaper, right? Limit networks, co-pays, deductibles, restrict coverage, make sure there's prior authorization before you can get that MRI or that CAT scan or whatever it is, right? We've had 40 years of reforms to make it literally more difficult for human beings to get care. That doesn't seem like we're going down the right path. So the result is we're using less care, but we're spending twice as much, and we got worse outcomes for it. Principles of a good healthcare system. Let's see if we can kind of agree on this. Should cover everybody. Should cover all medical needs. Because guess what? Dental, vision, those are actually medical issues. Surprise, surprise, right? Mental health issues, substance abuse issues. Let the patients choose their own hospitals and doctors. That sounds like a good idea. Let's reduce costs by cutting administration, not denying people care. It should be affordable to all, some sort of a premium based on income. Let's put a focus back on preventative care. Let's make sure we have enough providers so we don't have to worry about waiting, right? Long lines of waiting. A lot of people think, oh, well, Canada, they wait. Wait. People die in this country waiting for health care. Nobody dies in Canada waiting for health care. They may have to wait a little longer to get that knee replacement, but they are not dying because they can't access health care. That only happens here. Maintain Minnesota's leadership in medical care, research, and technology, because we're pretty good at that stuff. We want to keep that up. Pay providers a fair wage and in a timely manner. That'd be nice. Lots of physicians will tell you they don't get paid very regularly. Simple, understandable funding and a payment system. That makes sense. Well, it just so happens we got something just like that in the legislature right now. It's called the Minnesota Health Plan. And it's governed by those principles, and it's a focus on well-being and public health, not profits or politics. It's really Medicare for all plus dental, plus long-term care, plus vision, right? All the things that actually matter to our health. So how does it work? We use the existing providers, nothing changes there. Everybody's covered, you just get a simple form and sign up. You get a card, you use it wherever you need to. There's no deductibles, no co-pays, no networks. Families would pay by premiums based on income. Employers would no longer have to shop for and try to figure out, ooh, what are we going to offer this year, and can we afford this or that, or switch to a new provider, a new insurance provider. Providers negotiate rates and compensation with the Minnesota Health Plan Board. It's governed by that board that is democratically selected. There's no board CEO that's going to make a multi-million-dollar compensation. The board administers the health plan bound by those principles, and they negotiate the prices, and it acts to end these conflicts of interest that exist, right? If we want to get to making sure that hospitals don't close in greater Minnesota, we need to do regional planning around health. That's what it should be based on, not whether or not you're going to generate a profit for the corporation that happens to have a hospital in the town. So we got some opportunities here. We've got a governor's race coming up. We've got all 134 seats in the House, and currently the Republicans have the majority. They are not incredibly supportive of moving towards this type of a plan. So we have some work to do there. Both of the Minnesota U.S. Senate seats are up, and then of course all U.S. congressional seats. So on a national level, just so you know, there's two bills. Senator Sanders has S 1804. You can look that up. That's a Medicare for All Act of 2017. And our own Keith Ellison at the moment, as a member of Congress, is the sponsor of HR 676, the Expanded and Improved Medicare for All Act. So we really are in a place in time right now where this is a big issue. People are moving in that direction. They get it. When you're looking at Democrats and Republicans on the issue of health care as a need and therefore accessible for everybody, you can see that the polls are leaning in our favor, regardless of where you are on the political spectrum. And just something to think about, when you're talking with progressives, they see it as a right, not a privilege. It has to be universal, comprehensive, it should be public with no financial barriers. Conservatives will focus more on like a doctor-patient relationship, that's a sacred relationship, right? Entrepreneurship, we want people to start businesses. We want, farmers to be able to produce. Lowering costs, making the providers free market, and this system does. This is not a socialized medicine thing I'm talking about here, folks. That's not what this is. It's publicly financed. It's a financing system, but it is privately delivered. The doctors and the nurses and the hospitals don't belong to the government, okay? And it supports small businesses. Independents just want to make sure there's minimal federal intervention and that they want to eliminate the corporate profiteering. Well, this does it all. So, you can get involved by talking to your legislators. You can invite me or anybody from HCAM or from LSP to come and talk to different groups that you might be a member of. Host a house party. Let's talk to neighbors. Let's have these conversations one-on-one. If you are a nurse, come talk to us. We're M&A. If you are a health professional, both doctors as well as interns, etc., PNHP, Physicians for a National Health Program. Your land stewardship folks. As Isaiah, Main Street Alliance is working on this from a small business perspective. And then we have our friends Healthcare for All Minnesota in the back of the room, and Take Action Minnesota is also working on this same issue for the general public. So I don't know about you, but if we're going to talk about healthcare, I'm going with the scrubs over the suits when I try to figure out which way I think we should go. Because nurses are patient advocates both at the bedside and in the community and in the halls of Congress as well. And they're fighting hard to make this happen for you all. So we think it's imperative. We need guaranteed health care for all.
Thank you.